Joining us now is Dr. Eric Beck. He's from the Valley Center for Nerve Studies and Rehabilitation. Today, our topic is carpal tunnel syndrome. And I remember growing up, you always, your teacher ended up with something like that, and we all thought it was from writing on the chalkboard. So tell us about the treatment for carpal tunnel today.
Well, Christy, carpal tunnel syndrome is probably one of the most common conditions that I diagnose in my practice. And as you may know, carpal tunnel syndrome usually involves pain, numbness, and weakness, usually in the thumb, index finger, and ring finger. Usually, after I diagnose the carpal tunnel syndrome, people ask me, what can I do to avoid surgery?
Because a lot of people, would like to, if they could, avoid surgery. So what are some of the treatments, the non-surgical?
Well, in mild to moderate cases, I usually recommend treatments such as braces, exercises, anti-inflammatories, and sometimes steroid injections.
Okay, so what if those non-surgical treatments don't work?
Well, if the condition isn't getting better or if it's getting worse, I usually recommend people go see a surgeon. For example, if you can't get a pitcher of iced tea out of your refrigerator or lift a pan of cornbread out of the oven, then you really need to go see a doctor. And carpal tunnel surgery is very effective with a minimal recovery time.
Okay, so what can people do to maybe prevent something like this? Maybe, they think, I think I might be at risk for something like that.
Well, you may not be able to prevent it, but the key is to recognize it early. Okay. And that's really the key, is to diagnose it. Once we know what's going on, if you do have carpal tunnel syndrome, then we can address it by treatment.
Okay, so who is most at risk? Because I know I type all day. Is that something that would put you at risk for that? Or
that can. Women tend to have a higher percentage of carpal tunnel syndrome. Sometimes people do repetitive activities. And also, as we get older, we have a higher incidence of carpal tunnel syndrome.
Okay. So early detection is the key, and if so, you can get in touch with Dr. Beck. Here's his phone number if you want to get in touch with him, if you know that you might have some carpal tunnel issues that you want him to take a look at. It's 382-1603.